All right, perfect. So hello, everyone. Once again, welcome to workshop number 2. I appreciate y'all coming out tonight to our second workshop of the spring semester. If you have any questions, don't feel shy to just say something, or I'll do my best to keep up with the chat. But if you have any questions or comments, don't be afraid to make them. So like I said, we're covering the specialties of physical therapy. There are 10 different ones, so this shouldn't take that long, but I'm interested. Do y'all have any particular specialties that y'all are interested right now? And if so, why are you interested in that particular one? Does anyone want to share? Let's see the chat. Neuro? Props to you. I don't think I could do neuro. That sounds so scary and so complicated. Pelvic? It seems challenging. Okay, I'm always up for a good challenge. Awesome. So it seems like some of y'all already have a good kind of knowledge about different specialties. But if you only know a couple and if you want to learn about more, this is what this workshop is for. Neuropediatrics, general physical therapy. Awesome. Thank you. Okay. Now, with that in mind, let's see if we have different interests or if I can sway y'all into different specialties that you may or may not know about. So let's get started. So I really like this picture. I found it online. It's a really good diagram of just like physical therapy as a whole, but then different specialties connected to it. So these are all the different abbreviations of all the specialties we'll be covering tonight. So this is just a nice little image for y'all. Okay, so the first one we'll be talking about is cardiovascular and pulmonary. So the abbreviation for this will be CCS. So this is actually the first board certified specialization. So this is probably like the one that a lot of people are familiar with. It's very common. There's a lot of research behind it because it is the first one. So this concerns lung and heart conditions, as you can see with cardiovascular concerning the heart, and then pulmonary concerning like the breathing passageways and everything. So you'll be dealing with patients that experience heart attacks, open heart surgeries, and chronic obstructive pulmonary disease, also known as COPD. So as a PT in this specialty, you'll be dealing and helping patients learn how to improve their breathing and then also their aerobic capacity, which I think is really fascinating. I found this picture that's really cool. So as you can see, this patient is on a treadmill with all this equipment. And I'm assuming that these computers, the screens are showing like their heart rate and everything, which is really interesting. I really love cardio, which is uncommon for people that like to work out, but it's really interesting to think that PT can be associated with learning, with teaching people how to improve their breathing. Like as a healthy individual, you think, wow, like you have to teach people how to do that again. It's so simple. Like we've been doing it for so long. But with PT, you're helping people learn the basics again, like learning how to walk. And then in this case, learning how to breathe. So this is really interesting. I'm assuming you get to work with a lot of cool gadgets that connect to your heart and everything just to track that and then show progress over time. So for each slide, I did include different requirements for receiving that specialization gradation. So there's you have to be certified in advanced cardiac life support, and then you also have to have evidence of a clinical data analysis project within this field, and then you also need to meet the prerequisites of the patient care in the specific area, so cardiovascular and pulmonary. Okay, number 2, this is actually one that I'm very interested in, geriatric clinical specialists. So the abbreviation for this is GCS. So this is becoming more relevant because as we're seeing the older population is increasing. Old people never go away. So this is always very needed. And we're actually seeing that there's an increase in demand of geriatric clinical specialists just because of that large population aging. And then also different things that contribute to needing PT. So if you think about it, when we're on our phones a lot, there's actually something happening with our necks. We're getting like this lump in our neck because we're looking down so much, like kinks in our neck, like sleeping wrong, driving for long times. There's a lot of different things that contribute to a lot of pain and discomfort that affect us when we get older. So this does deal with a lot of musculoskeletal conditions. Some examples are arthritis and osteoporosis. There are some neurological diseases as well, because with aging, you can also get some Alzheimer's and Parkinson's as well, which will affect your musculoskeletal system and everything. So I put this picture because I think it's kind of fun. Like you see some elderly patients working out in the gym. Personally, as a technician, I'm not sure how many people in here are techs or have been techs or have observed, but the older patients are actually really fun. They can be very blunt with stories. They have a lot of humor. I'm not sure if any of y'all can relate. I had this old man tell me one time when I was helping him put on like a pair of pants for the anti-gravity treadmill. He said, "Don't pull down my pants or else we're both going to regret something today." So I just really like that environment. I know some people are kind of scared of old people, or like they can't like deal with them that well, but me personally, I'm very interested in this one just because you get to start everything at the basics, like teaching them how to do things again. So it's really interesting to me. So overall goal is to help maintain or achieve optimal level of health. So not necessarily help them heal, but some of the time it's just making sure that they are continuing to be able to like stand up or sit down or walk without a walker or a cane. It's not necessarily they have to have a condition really to be a patient in this over specialist. So like I said, there's a projected to increase in demand of geriatric clinical specialists. The requirements are 2,000 hours of direct patient care and a completion of the APTA accredited residency. Oh, okay. So the next one is the orthopedic clinical specialist. The abbreviation is OCS. So this is the most popular specialty. I'm sure a lot of y'all are familiar with orthopedics. In June 2019, there's an estimate of 15,600 estimated specialists in the US, which is insane. It's, as you can see, fairly popular among the PT world. And most of these treat injuries and conditions that concern the bones, muscles, tendons, ligaments, joints, and they also specialize in treating patients after post-surgery. So as you can see, this is a ACL tear, helping ACL patients. So really in like any surgical procedure, so like a total knee replacement, hip replacement, most likely an orthopedic specialist will be treating that patient just because they are specialized in that field. So it is usually an outpatient setting, and it focuses on the functionality of the body. So making sure that it's able to function fairly well without risk, like high risk of injury repeating. So the requirements for this field will be 2,000 hours of direct patient care, completion of APTA residency. Like I said, most of these requirements will be very repetitive, just because it seems like it's a very standard requirements throughout the different specialties. So the next one will be neurology and clinical specialists. So the abbreviation for this is NCS. It is high in demand right now, probably because the complexity of this field might be a little intimidating and a little scary, but just remember it's high in demand, and I'm sure if y'all are really passionate for it or find yourself that you're really passionate for it, it'll be less tasking than it actually seems. So this treats with neurological disorders, injuries, and impairments. You can mainly find these specialists in hospitals and rehab centers. So this is a cool picture I found. As you can see, you're going to be working with a lot of different patients that are not really able to do much just because of the neurological condition. So as you can see, this patient's in like a harness and also a wheelchair. I'm not really sure what's going on, but it does seem like it's going to be a very patient journey, just because neurological conditions do take a lot of time and everything. So if you are really interested in that, just remember all the things that come with it, apart from the knowing and learning about the neuro part of it, but also being an emotional support person for your patient, because this does seem like a field where it's going to have to, you're going to have a lot of hope and optimism as a clinician. So requirements, 2,000 hours and completion of APTA residency. Okay, next up, we have pediatric clinical specialists. So the abbreviation is PCS. So this can range from newborns to teenagers. I always thought it was always just like 1 year old to like 10. I never thought it could go up to teenagers until I was actually exposed to Kinetic Kids, and I found out that it actually ranges up to people as old as 18 years old, which is really fascinating, and I feel like might be a misconception. So just remember that you're not just dealing with babies and kids in this specialty. Some conditions that patients are treated for and that you'll work with have cerebral palsy, autism, and cystic fibrosis. Some goals of this specialty will include improved range of motion, strength, flexibility, and movement patterns. What's really interesting about this specialty is that as your patients are very young, you're going to be helping them improve their gross motor skills, which is incorporating your large muscle groups. And I'm not sure if any of y'all have taken motor learning yet, but at this stage in these ages, this is where a lot of Individuals are learning how to do basic things, so like grabbing, like raising their arms, like learning it for the first time ever. It's not like you're reteaching an older person how to walk. You're teaching someone who's never experienced walking before ever in their life, and helping them learn how to incorporate different muscles. So this is really interesting. There seems to be like a huge emphasis on also looking at the development over time of patients with their motor skills, which is something that I think is really cool about pediatrics. So this is just a cute picture. I've never observed a pediatric clinic personally, but I've seen videos and it just looks like a fun little playground time, like daycare almost. But as you can see, this patient is climbing up kind of like a slide, and the physical therapist is back there just helping her. So if you love kids, if you think you can handle this, if you are really passionate about motor skills and everything, motor learning, this might be something to look into. So the requirements here, 2,000 hours of direct patient care and the completion of accredited residency. Okay, oncology. So this is the physical therapy world where you deal with different types of cancers. So as you can see, we have a patient who is diagnosed with cancer working with their PT on this cable column in this picture right here. So these patients can be undergoing or recovering from cancer because when you're diagnosed with cancer and you undergo different treatments, it can be very taxing on the body. You can experience a lot of chronic pain, weakness, and you can lose a lot of your bone density. So PTs are very important in this with minimizing the pains that come with it, improving your strength, to prepare you and kind of strengthen you for any treatment and to help you recover from that because it is very draining. So like I said, it helps patients with side effects, maintain strength, and then you can also, PT can be applied at any stage of the cancer treatment. So it's not just like you're preparing them for the treatment and you stop and then you're prepared, you help them after the treatment too. It's just like at any stage needed, you can help your patients. So like I said, for neuro, I feel like at this specialty, you really have to have a servant's heart. You have to be very empathetic because these patients are already coming in with a loss of hope, with a lot of things on their chest. And you just have to be someone who is so optimistic and just so happy and hopeful, but also at the same time, very understanding and empathetic with patients. And as a PT in general, like you have to have those things. But in this specialty specifically, if you are someone that wants to be that close with your patient and really just supportive, I would really recommend this, just because it does seem like a very close-knit, intense, emotional connection, as well as just supportive environment for these individual patients. So the requirements are 2,000 hours of direct patient care and completion of accredited residency. Like I said, it's repeating a lot. All right, so next up is the women's health specialists. So the abbreviation for this is WCS. And as you can see in this picture, there is a pregnant lady, I'm assuming working on maybe some lumbar issues. I'm not really sure, but I like this picture a lot because it does demonstrate the different demographics you could be working with in the specialty. You could be working with a perfectly healthy individual who just has some lumbar pain, some pelvic pain, or you could be working with someone who is pregnant and just helping them live more comfortably and prepare for their pregnancy and everything. So this is actually a newer specialization. I think it's been around, it's fairly recent, but of course there are still improvements being made and of course more research being done. And this treats women of all ages. So it's not specifically like middle-aged women or elderly women or young women, anyone, which I think is really unique because I think that's something that's really cool because a lot of people tend to forget the issues and side effects that do come with pregnancy, like learning how to normalize your gait more when you're walking as you're carrying a child, learning how to recover from delivering a child, any pregnancy problems that you can undergo, and then just focusing on a lot of your lumbar and core because of our pelvis, which I think is really interesting. Like I said, so it helps pre and postpartum issues, pelvic floor therapy, and it's also a very less invasive solution. So instead of going into treatments and everything, patients will be sent to physical therapy because it is less invasive and it can most likely make things a lot better for them. So some requirements are 2,000 hours of direct patient care and completion of accredited residency. Okay, number 8, electrophysiologic clinical specialist. So this is abbreviated as ECS. As you can see, this picture actually kind of terrified me. I thought the little prongs were going into the foot, which I was not vibing with for a second. But as you can see, there's little like electric pads and a little machine on the side. So this is actually one of the newest physical therapy specializations. So this is working with different machines and technology that concern nerve and muscle damage. So these conditions would be caused by skin integrity and wounds. They use electricity to heal and incorporate technology and advancement to treat and relieve pain, enhance blood flow, and avoid clotting. So I think this is really cool because as a PT, you're already going to know how to treat a patient and everything. But then you also have this separate knowledge of learning how to apply the technology and all the advancements that are being made in the medical field to improve and kind of expedite the healing process, which I think is really cool, just because I'm not really a tech person. So just knowing how to work all these machines that were made to help heal us as humans is pretty fascinating. So if you love little gadgets and everything, maybe look into this. I think that's really useful information. I don't know if any of y'all have been in a clinic, but just seeing different machines that you haven't been exposed to, it's just like, wow, like how do they know how that works? Like I think that's pretty interesting. So as you can see, the requirements are very different for this specialty. So you need 1 to 3 learning experiences and a letter of recommendation, which is kind of interesting about the letter of recommendation, but it's probably because it's just a newer specialization and everything. And then you also need to submit actual patient reports from the last 3 years about all the patients you treated and everything. And then as the other ones, 2,000 hours of direct care in this field, and then accredited residency. Okay, next up, this is probably one of the most popular ones because I know a lot of people that are interested in physical therapy were in physical therapy because they were athletes and they want to help other athletes. So this is the sports clinical specialist. So the abbreviation is SCS. So this PT will treat any athlete, so amateur to professional, which is really cool to think that if you specialize in this, you have like a chance to maybe treat one of your all-time favorite players, you know, like I think that's pretty cool. But then you also get to relate to anyone that used to play a sport that you've played before. So it's definitely a nice little bonding like team, like, oh, I've done this before, like anecdotal situation for you to be in, especially if you're really big on sports and everything. So the article I read told me that this is actually a great specialty to start your career in. I'm assuming just because if you have a relation to sports in any way, it's kind of easing you into the field to make you more comfortable. So like talking to patients, like, oh, like you played soccer, like I played soccer too, like what was your position, blah, blah, blah. That's just my assumption, but they did note that this is a great career to start specializing in. There's a holistic approach with this. These specialists can be found in sports medicine centers, hospital clinics, athletic environments, but they can also be in really any clinic, just because, yeah. So some requirements are different on this one. So you're going to have a CPR certification, certified acute management of injury and illness in sports medicine, and then the 2,000 hours of direct patient care and completion of accredited residency. So as you can see in this picture, you're going to be dealing with a lot of different patients that are going to recover from whatever injury they have, and then they're going to be doing a lot faster paced things. So as you can see, this patient's doing some ladder drills and the PT's examining, making sure that the foot's being placed right, making sure like the leg's intact, like the knee stable, ankle stable, like all that. So if you're kind of wanting a more fast-paced environment, if you want to relate to your patients because they played sports, if you want to bond over that and help them like your PT helped you, like this is something to definitely look into, just because it is, like I said, like any realm of physical therapy is going to be a very personal, emotional journey. You're going to be not only someone's clinician, but also someone's friend, basically. You're going to need to support them and basically go with them through their healing journey and just be there for them. So, yeah. All right. And the last one, this one's very interesting. I think this one's it's not for certain that it's a specialty, but it's trying to be one. So this is wound management and specialist. So I don't have a lot of information on this one, but this is an up and coming specialty. So like I said, the most recent, still under development, but it's focusing on treating superficial and deep wounds. So it emphasizes the relationships of all the body systems, which I think is really cool. So I'm not sure if you guys have learned this yet, but like the healing process and everything, there's different stages of the healing processes. So it's going to talk more about just your musculoskeletal system. It's going to be more than just muscles, bones, and nerves. It's going to incorporate like your circulatory system, everything, because a wound, it's going to be invasive of your whole body. So this PT specialty is going to be kind of more big picture versus like focus on something else. It's going to be incorporating different aspects of the body that regular PT wouldn't really focus on. So I think this is really interesting. I wish I could find more information about this one, but as you can see in this picture, they're just treating a wound on this patient. So some other things, they help prevent and heal wounds, which is interesting because I wouldn't really associate like, you know, like cleaning and preventing wounds and healing and everything be part of PT. I just think of it more as like, oh, okay, they're healed. There's no open incision or anything. Like, okay, let's fix them. It's kind of just like helping them along the way as they're healing and dealing with fairly recent wounds. Some other things I found that this specialty will require PTs to do would be measuring the wound and expecting the wound. So kind of like tracking the healing progress of the wound as well as helping patients strengthen their way around it. So like if I had a cut on my arm and I couldn't bend my arm because of the incision, say it's like right here, and as we're measuring it, it gets smaller, we're slowly going to start strengthening our arm back to performing flexion. So like I said, wounds contribute to mobility problems. So as a clinician in this field, it's going to be very tasking as just kind of waiting for the wound to heal itself and then working to heal the patient surrounding that after. So like I said, this one's very new, but very interesting. I personally can't look at like big cuts or a lot of blood, but this does sound really cool just because you're not only doing PT stuff, but you're also like tracking the progress of, I think that's cool, like measuring the wound and stuff. So yeah, if you're into that, hopefully this somehow gets more, I guess, certified, and then more research is done about it just because it is the most recent and still under development. So because of that, there are no requirements because it's not a specialty yet, but it is up and coming. Okay. So that is it, the 10 specialties of PT. Does anyone have any questions? Any questions at all or any comments that you found interesting? No? Okay. Well, you guys can scan this real quick, but before you leave, I'm going to take a picture of everyone. So if you could please turn your cameras on, that'd be great. But yes, I'll let y'all sign in, but I'm going to stop sharing and then I'll send the link through the chat in the Zoom chat and everything. Can y'all hear my cats in the back? No. Ah, okay. Does anyone need the link still to the? No.
I do.
You do? Okay, let me send it.
I need it, Margaret. I didn't get it.
I'm going.
Send it to me.
Yeah, I got you.
Thanks, girl.
Of course, of course.
Sorry, I actually didn't get it either.
Okay, here, I'm sending it in the chat for everyone that did not get it. Yeah, perfect. All right. Let me stop recording.